Welcome back, guys. I'm not going to do the year. Thank you for tuning in. We have a very special guest today. I'm actually nervous to get into this conversation because it's going to be about medical terms and prescriptions and drugs and stuff like that. And that is not my forte. But once we do get into the financial business side of it, I think I'll shine a little bit more. But thank you for tuning in, guys. Our special guest today is Nicole.
Hi.
I didn't want to butcher your last name, so
That's
Nicole
okay.
It is.
Caffiero.
Caffiero.
Yeah.
There you go.
Nice.
Nicole Caffiero. Today's episode is going to be about why healthcare feels broken, but the drug side of it.
Yeah.
So what's a correct way to say that? Not drugs. I feel
No,
like
it is.
it sounds
that's the correct terminology.
but it sounds illicit. You know, it feels like
Pharmaceuticals?
Yeah.
the pharmaceutical end of healthcare.
Yes.
Welcome to the show.
Woo! It's my Broadway debut.
So before we get into it, give us because you are an official speaker for your company and your industry.
Yes, she is.
Give me your professional introduction, your credentials, so that the people that are watching this know that we're not coming from just of our opinions.
Sure.
The questions that we're going to ask is still professional, and we're not going to be like, well, you know, she's not in the corner popping pills and giving out.
No, she's not.
You know, like it's just like, this is what you do for a living type of. So give me your intro and what you do and where. I mean, I guess you don't have to say where you work, but.
Yeah, I won't say that. But I will say, no, so I'm a pharmacist by training. So I went to pharmacy school. I got my doctor of pharmacy. And then I did 2 years of postgraduate residency training. You don't have to do that for pharmacy. So you can finish pharmacy school, get your doctorate, and go work anywhere. What I did was specialized. So I did 1 year. That made me a clinical pharmacist. So that's where you learn more to how to practice medicine and how to be the medication expert to the doctors, right? Because we get 8 semesters of pharmacology. MDs get 2.
Yeah, that's light work. You know, it's light work.
Light work.
Yeah.
That's overwhelming.
Yeah. So
For a college dropout,
Right.
that is. So
I am a punishment in a different way where I just kept going back to school. You know what that's like.
Not sure why I'm doing this to myself. You know, I could have stopped at a bachelor. You know, you've done it.
But it's okay. It's all
But
good.
it's okay. It's fine.
You never regret it.
You know, it's fine. I do regret it right now.
You regret it during
but we'll talk about that at a later time.
Yeah. So then my second year of residency training specialized in ambulatory care pharmacy. So think ambulatory walking, right? The patients can walk. They're not critical care. It's a lot of chronic disease state management like diabetes, high blood pressure, that kind of stuff. I went and practiced for 5 years actually seeing patients. And then I transitioned more into like an administrative financial role.
ooh,
And
I like that.
I love that. I love that.
That is when, because part of what you see in medicine a lot is, and this I think is what we're going to talk about, is that clinicians know how to treat a patient, but they don't know how the system works.
Right.
And our business people know how to run the business, but they don't know the intricacies of treating a patient and why you may need certain things. So I went back, I got my MBA, and that's when I moved into the role that I'm in now, where it's more on the administrative side. It's more about how can we improve population's health. So it's not one-on-one patient care. It's more
Macro level.
exactly.
Okay.
Exactly.
I shined there for that 1 second.
Probably cookie.
You're always shining.
I'm gonna need you to dumb it down for me a lot and I think I'll be the one that helps the audience for the ones that aren't in the medical
Please.
side of it. Kady shines in her medical talk too.
I mean, 16 years in this field. And I know it gets annoying because he tells us all the time, like when Sadie and I, my sister and I are talking, we talk very it's just jargon. It's medical jargon, and he's just like what
Mhm.
Right.
What are you
But
saying?
yeah, but you'll catch up. It's fine. It's
I
okay.
won't ever catch
You
up.
will.
You know when you're in the ED and they're just throwing abbreviations and
It's just becomes such a language. Like it
Right.
becomes so normal to just talk like that. I've gotten used to giving the providing the word for the abbreviation, because like, for example, my new hires, they are just like, there's some that have absolutely no medical background whatsoever. So I have to tell them, okay, well, this is what I'm referring to. This stands for this. So I'm trying to do that more with him so that he kind of like follows, the flow, because it's natural. Like you don't notice when you're doing it, especially because you're doing this all day, every day at work. You would know, so
100%.
yeah.
Right. So look, I want to get into your experience and I want to also intersect it with us being first generation Americans. We're Dominican and you're Italian.
Which is just the Dominicans of Europe.
Right. So I think
Wait, pause. Have you heard that before? Manny's never heard that.
No.
But yes.
But it makes a lot of sense
Yes.
to me.
Yeah.
So I think we have more similarities when it comes to that than differences. And I definitely feel like there's something, I don't know if it's a socioeconomic issue. I don't know if it's a cultural issue. It's just like, I really want to understand why is it that our parents, specifically for us first generation Americans, why they're so, I think the best way to put it, I think, is they're anti-medicine or prescriptions or drugs. And I don't understand it. I think there is a world where you can balance both putting on Vicks Vapor Rub, which Dominicans find to be the solution to everything.
Wait,
Indeed.
Italians too.
Didn't I tell you? The Dominicans of Europe.
Right. So I definitely want to bring that cultural angle. I definitely want to also speak on why I feel like for a lot of us, the system is broken, which is tough. And I think it's so layered and it's so complex, but you're going to dumb it down for me, I think. I hope.
But I mean, that's the problem, right?
Right.
Isn't that exactly what we're getting at?
Yes, that's part of it.
Yeah.
And it's hard to come to this country and to understand and to trust, because it has also a lot to do with the government side of it. A lot of our families come from places where the distrust with government and the corruption is so backwards. It's just like the political realm is so backwards. I guess that's the best way to put it. I don't want to curse and say, what it really is. But there's always money to be made in our countries, in our home countries. I mean, I'm American, so my home country's here. But for us to explain that to them, that now they're in a realm or a country where, to a certain extent, they're not trying to trick you and they're not trying to I don't even want to say that, because I do feel like sometimes I feel like a cow when look, okay, let me make this a little bit more structured. Why do you think, both of you guys, why do you think there's a disconnect with our parents, to not go too far with it, and medicine? Why do you guys feel that there's that disconnect?
Well, funny enough, I don't know how to answer that question, and I'll tell you why. Because every trigger alert for Dominicans that are still there, especially, right? They all swear they're doctors. They all self-medicate. Okay, so it's just like, I don't know that there's necessarily a disconnect. I think the disconnect is in actually finding proper medical care for proper prescription. I'm trying not to use jargon. But to be properly prescribed medications, right? In DR, I mean, I'm hoping that Italy is a little bit more regulated, but in DR, if you are having muscle pain, back pain, hell, you broke a finger and you need, you know, something like an opioid. Best believe you could get it at the pharmacy. You know, go in, tell them what you need. Here's what it is. How many do you want? Here you have it. And then you can walk out. Right. So, and everyone in the country knows this, right? This is, you know, countrywide, right? Everyone does this. So you go to the pharmacy, just get what you need. Or you get what you think you need, you know? And so having a medical conversation with a Dominican, especially of my mom's generation, is actual torture. Because there's times that I'm sitting there and I'm fighting for my life, trying to get them to understand that what you are saying and or doing is completely unacceptable, right? You shouldn't be, like, abort mission, and they're still going head first. So I don't know that there's a disconnect. I think it's just, and I don't think that it's definitely not, it has nothing to do with miscommunication. It's not, you know, it's not a lack of education. Or maybe there is, to a certain level there is.
There's probably a level of ignorance.
Yeah, but there, I think that's where I would lean more towards, is maybe a level of ignorance, but also just, you know, the lack of understanding, or I'm still trying to figure out what it is, because there's definitely not a disconnect. They love medicine to a detriment almost. But it's hard for me to answer that.
I think it's distrust. I think it's what you, and I think it's for.
In what sense?
So I think it's distrust of the medical system.
Okay.
That they don't think that they're doing what is best for the patient or them.
Okay.
Right. So I feel like, I always joked, I'm not first generation, but my dad is my worst patient. Like
Yeah.
And he very much is like, I know my body better than them.
Yeah.
Right. So there's, or I know better. Right. There's that, it's almost like a lack of respect of the education.
Right.
And I don't think it's intended to be that way.
Yeah.
But as someone who's worked very hard for my degree, I do feel that at times it's like insulting, and I need to kind of separate the emotion from it, right? But it can be insulting at times. But I do think it comes down to just a sheer lack of understanding of the system, of medicine itself. This is a kind of technical example, but there's a drug called metformin.
Yep.
Here we go.
Yep. It's for diabetes.
Yep.
It can be for if you have like polycystic ovarian syndrome, which now there's a new term for that, but it can cause really bad diarrhea. So patients often think, well, I'll take it every other day. That'll help the diarrhea. Or half.
Yeah.
Do you know that your diarrhea gets worse?
Yeah.
If you take it intermittently, when you take it consistently, that eventually goes away.
Yeah.
So patients are actually hurting themselves by doing that.
Yep.
We just made a first breakthrough.
Right.
That's such a good point. That's such a good point. Because in my mind, if I take, what's the name of the medicine?
Metformin. Let's say whatever. Yeah.
Metformin, and my body reacts that way, my inclination is going to be,
I'm going to stop this.
I can't take this. My body is reacting negatively. Why would I continue? One, I would run back to my doctor and I'll be like,
but that's a part a lot of people miss. But go ahead.
Right. So I would run back to my doctor and I'm like, oh my goodness, my body's reacting negatively to it. What should we do? Should I cut it off? Or, like you said, am I going to continue to take this medicine and in time is going to get better? And do I trust that answer?
Right.
Which is a huge hurdle for me. So because to go back to the original question, for me, at least remembering my father, the only time he ran to medicine was to avoid death. So, but for me, I think there's also, of course, I'm going to bring the financial side of it. There's a socioeconomic issue to it as well. Only certain people in Dominican Republic have the resources and the access to certain type of care. And I think that trauma was brought from Dominican Republic to here. And so the way that my dad used medicine or the doctor or healthcare was very sparingly. It was, something's wrong, I need the solution, I'm going to get it, and I'm not going to go back. Unless I'm dying, of course, which is run to the ED. So from that angle of it, I think it does have a lot to do with money. Like we we come from countries where if you don't insurance is like, yes, you can get it, but it doesn't really work.
Right.
So over there, even if you go to a pharmacy, it's pay out of pocket. Like it's not that it's so much for us Americans. I hate to say that it's not expensive. It is expensive
But in
someone
comparison.
else. In comparison, but for us, it's like, oh my gosh, it's $5. Like, what's the big deal? Go to the pharmacy and get it. So for me, yes, I don't think it's a disconnect. I think it's a socioeconomic issue that was ingrained into them, and in turn, they, at least for my dad, he used it sparingly, only when it was a necessity.
You bring up a really, really good point that I think American healthcare has evolved or is trying to evolve to more prevention, and we're trying to reward that.
Yeah.
But the culture hasn't evolved with it, right? Where you're saying like your dad came here and it was like, well, I only go to medicine if I'm dying.
Right.
Well, and that makes treatments more aggressive when the doctor finally sees you, right? You're unable to catch things earlier. So I think it's the healthcare has evolved, but maybe the culture where they're coming from didn't.
Right. But and to piggyback onto that, and then when we do go to the doctor, that first inclination, I'm taking medicine and it's making me feel worse.
Right.
When it's just, what is it, a secondary?
A side effect,
potentially,
or it may not be the right med for you and we have to find it. I mean, medicine is an art.
So that's where the, I'm good, I'm not going to do that type of thing
like
comes.
I'm out.
So is it cultural or is it socioeconomics? Is it for me, I think from hearing you both out, it seems like it's all of them put together. And then to some people, so for my mom, her coming here and then getting Medicaid, or then, well, I think originally she had Medicaid and then she got insurance through my father. I think she uses and abuses it. So for her coming from a country where she had nothing, and now it's like any and every little thing, she's running to the doctor.
Yeah.
And I don't know if that's good either.
Yeah.
You know, because the mind is a powerful thing. And,
Yeah.
you know, sorry, Mom, I don't like to like use you as a, but you like, I have to come from what I've seen.
Yeah.
And I personally think she overuses medicine.
Totally. Or like someone who demands an antibiotic, even if the doctor says that they know the infection's viral. An antibiotic's not going to work, but I want something to treat whatever's happening, right?
Yeah, I want antibiotics for the flu.
Exactly. Like
that's huge, you know. I want antibiotics for the flu. It's just like you don't take antibiotics for the flu. You just write it out.
Really?
Yeah.
I just drink water.
I mean, in his head, he doesn't get the flu and he doesn't get sick. You know, which I think is a good thing.
I don't make it up.
Yeah.
But I do know where to draw the line. So I do have a lot of tendencies of my father.
Yeah.
But I do know when it's like, oh my gosh,
it's time to be seen.
We need to be seen.
Yeah.
And that's a really important distinction, right? You need to know when to escalate care.
Right.
That's,
it's either he escalates or I'm going to escalate it. So I'll give him a chance, you know, but.
So like, and I do want to like talk a little bit more about them coming to now, like them immigrating and coming to here, and what you've seen in your end of, because again, it's one extreme or the other. It's my mom or my dad, in my opinion. It's either they overuse, and for me, and this is where I feel like there is a bit of pushback against science. Is like, why is my mom not getting better? I think personally it's mental at this point. And then my dad that didn't go to the doctor a lot, he lived a pretty healthy life. Like, so it kind of pushes like, hey, like, did they make it up? I don't, part of me is like, no, they didn't, because there are people that they live at the doctor's office and they seem to just not get better. So what do you say to that? And how do we connect the bridge, I guess, to our parents about it?
I think, unfortunately, every disease, every person is different. So you can't make sweeping generalizations when it comes to healthcare. And I think that's probably one of the biggest takeaways is, you know, when you're describing your mom and your dad and their different outlooks, right? But their health conditions are different.
Right.
So maybe your mom needs that higher touch care and your dad didn't. Or maybe, I don't know, he did eventually, but he refused it. You know, so I think that it depends on every person's individual case. And I think that's where it gets really tough with medicine, because you need time with your doctor to discuss, to make a shared decision together about what the best treatment is. And that's not what's paid for in this country. This country is not paying and rewarding for prevention and things like that. We're rewarding for volume. So sending your mom for a ton of tests, the doctor gets reimbursed for that,
Right.
not whether your mom's getting better or not.
Right.
But isn't that a good thing? Isn't my mom comes and she's like, I have an itch, and the itch doesn't go away. That's a horrible example.
Here's my gripe with big pharma, with medicine altogether. And my sister's an RN.
Mm-hmm.
As are my best friends. So I'm surrounded by medicine. And then on top of that, you're a medical pharmacist. You know what I mean? So here's my gripe though. Now more than ever, we see folks go to the doctor. You know, they're experiencing XYZ, comorbidity A or B, right? And the first thing that's done is, here's a prescription.
Mm-hmm.
Well, why don't we figure out what the problem is first, right? Cool. If I need a medication, if I need a prescription, that's fine.
Mm-hmm.
But why are we medicating versus getting to the root cause to then medicate if necessary, right? Or potentially making something worse. I feel like now more than ever, patients have to advocate that much more for themselves. I just caught myself doing that a month ago with one of my physicians, which I low-key now want to change. Great person, you know, been with this person for quite some time, but it doesn't make any sense that you are the physician and I'm letting you know what you need to do. Only for me at the end of the day to be right. You know what I mean? So it's just why I have this really huge gripe, because it's just, we're going to doctors and specialists and we're trying to trust you, right? And putting our health in your hands because you are the physician. You are the trained professional in your field to help me because I can't help myself.
Mm-hmm.
And the first thing you do is, instead of getting to the root cause and, you know, doing your due diligence as the physician or specialist to figure out what the problem is, you're just medicating,
Mm-hmm.
you know? And I think that because of, you know, there is a huge, gap in education, especially when it comes to medicine and, you know, that this realm of healthcare, people are just like, well, that's what my doctor said. That's what I'm going to do. So I'm going to medicate, you know, and they're going medicated for a long time, which is what I believe happened with your mom. You know, she has been medicated for so long, but no one's not actually getting to the root cause of the issue. You know, my uncle is another example. I went to the doctor. Oh, I'm, you know, for quite some time, I've been feeling this, you know, acidic feeling. And now it's starting to reach my, you know, my esophagus. And, you know, it's really burning my chest and it's not getting better, even if I take an antacid, right? Pepsid or something along those lines, right? Nothing's working. Nothing's making it better. Okay, we'll try this. Was literally his response. The visit was no more than 5 minutes. Try this. Let me know how it works. He says, well, okay, you're the professional. Tries it for 2 days. Then he does what we just discussed. He stops the medicine. He says, I'm not taking this anymore. It's not working. It's getting worse. Right?
Were they right?
But here's the thing. Now I'm 50-50 because I'm like, you know what? Half of me would have stopped it too. Is it advised? Absolutely not. But again, my gripe. Why are you medicating without figuring out what's the problem? You know, he has to go back. That's what prompted the doctor to do more research, to get necessary testing and imaging or whatever have you.
Mm-hmm.
He has H. pylori. You know what I mean?
Mm-hmm.
Now we're talking about ulcers in your stomach. You know, the lining of his stomach is completely irritated. You know, everything he eats bothers him so much as drinking water. So it's just like there is a huge disconnect there. And so are we not supposed to make the trusting, you know, like focus on the trust so that patients feel good about going to the doctor, you know, about figuring out what the problem is versus just being, you know, automatically medicated. You know what I mean? So I think that that's a huge contributor to why we are where we are today.
Yeah, and I think that kind of what you're getting at, there were so many things I wanted to say as you were talking.
Right.
What you were getting at is cost containment.
Yeah.
So
Say that one more time.
cost containment.
Cost containment.
How do we treat as many patients as we can, as effectively as we can, without bankrupting the whole system, because then nobody gets treated. So trying a $3 generic antacid is the potentially, I mean, I obviously don't know the case, but is potentially the more economical thing to do. And then if that doesn't work, then we'll run the tests that are much higher cost.
Right.
And because, you know, 90% of this, when this happens, it's GERD or acid reflux. You take the medicine, it gets better, it goes away. So we try that first before we run all the tests to try to save money in the system to be able to treat as many patients as we can.
I have a problem with that too.
Yeah. I have so much to say, not enough time to say it. So this is why the health system, to me, feels broken.
It is broken.
It is broken.
I mean, we can just say
yes,
that. It is
absolutely.
broken.
Totally.
Yes.
Is it a preventative care issue that we're having, or is it we're running quick to prescribe?
It is a
problem.
system-wide issue. It is the American healthcare system was built in small layers over and over and over again, and nothing talks to each other. So doctors are incentivized to, you know, let's say run tests and all that, right? So for volume, they want to be able to build volume. The insurer is incentivized to do as little as possible to in cost terms, but while keeping the patient healthy. So the patient's stable, let's try the antacid, and then, you know, so the incentives in each stakeholder of medicine, the incentive is different. So they're all trying to do different things, and there's not one entity that overlooks the whole system and says, this is how it operates. Everybody operates in their silos. So everything's just broken.
In theory, wouldn't the government oversee a lot of this? Like, so the government and then the branches are each entity. Aren't they the one that regulate to make sure that each one is kind of staying in their lane and doing right by, for like here, let's say the citizen? Aren't they who you would consider the person that oversees? And I don't want them to oversee it. I'm just saying the way that it's set up right now, is government the one that kind of says, you know, well, you shouldn't just be taking a patient and just automatically just throwing prescription at them.
Yeah, and there are lots of government regulations there's state, there's federal. It depends what kind of insurance you have, what those, I know, Katie, you know this probably better than me, but there's, you know, depending on what type of insurance, depends on what regulations there are. So nothing is consistent. So yes, they do have that power to regulate in different parts of the healthcare system, but there's not an overarching.
So in theory, there isn't a nonprofit organization or an entity that has no pull or incentive to side with anybody that kind of oversees this body of, which is this machine, because I like to call it a machine. It works like a machine.
Yeah.
That oversees healthcare as a whole.
Right.
Isn't the Department of Health or the CDC like?
But that also, it's not the same in every state, right? As well.
Okay.
Yeah,
Right.
it's not the same in every state. Every state has different regulations. For one, I've worked for both the state of Connecticut and now New York, right? Very different, absolutely different. And the conversations, I mean, I don't know how much I can say, but the conversations are also very different when it comes to cost reductions, preventive care, you know, to all that good stuff.
Right.
It's very different. Where I am now is much different than where I was, back in Connecticut. So it's very different for every state. I understand where you're trying to get.
Right.
But I don't think that I would ever want that.
Look, I'm starting to lean towards our parents right now. After everything you guys have said.
I am too.
So
but I also have a gripe with them.
Here's where I am right now from what I hear, because obviously I think this is all motivated by money.
It is.
Mm-hmm.
It absolutely is.
We live in a capitalistic country, which I'm pro capitalism 100%. I believe in open markets and all that stuff. But when it comes to the healthcare side of it, I'm starting to lean towards our parents and going with natural remedies and having good day-to-day habits to avoid the healthcare as a whole at this point.
See, but there's that's another extreme. You know what I mean?
Is it?
Yeah, it is. It is. It's extreme to extreme.
But from what I'm hearing from you guys, the system isn't incentivized in healing me. The system is incentivized in finding something wrong with me to put me in this vicious system.
You're not necessarily wrong.
Or machine.
But you're also not very much correct.
Right.
All the way.
But so where is the good in the healthcare that we currently live in today in the United States?
Where is the good?
Yeah, where's the good right now? Because from what I hear right now, I haven't heard where I can trust the system that in return, I can trust it enough that if I have some type of sickness or something's wrong with me, and I can trust them to get me back to a point where I don't need them anymore. Because from what I understand, healthcare should work that way. I should be able to go to a doctor and say, hey, doctor, my head hurts. He should be able to do everything that's necessary.
He or she
should be, the doctor should be able to run tests on me efficiently on your side and efficiently on her side too, so what I'm doing, guys, is that she's representing the health insurance and she's representing the doctor side of it, or the offices, or what are they called? The providers, the provider side of it. So, and there's a give and pull, and I'm the one in the middle because I'm the patient. So I should be able to come to Nicole as a provider, and she should be able to diagnose my headache or whatever's wrong with me efficiently so that she doesn't have to overpay to find that issue that I have, and come to a remedy, I guess that's the best word to use, where it's not going to be a vicious cycle where I'm going to stay back and forth between you two. It should be, I come to you, you're like, okay, he needs this, this, and this. We find the solution. We try to not over medicate him. And then once he's back to the normal levels, then he's out of there and he's out of the system. Isn't that how healthcare should be working?
Yes.
Because from what I see, they don't want you to not come to the provider anymore to a certain extent.
Who doesn't, though? I think I want to separate the staff from the system. Right. So providers, and that's something providers want to help you. You don't go to become a doctor, a nurse, any of that. That's hard work. It's physical work. It's usually someone who's a caregiver who wants to help. So I think that's the good, right, that you were saying before. And I think that's important to kind of differentiate that, like, the system works against providers too. Like, they feel the provider burnout. MDs have like a very high rate of suicide.
Oh, absolutely.
Like,
Absolutely.
you
That's
have to
very true.
separate the two things, but you can't, right? Because they operate together.
Right.
But
that's what I'm saying. Because I think I'm the customer, and you guys are the providers. She's providing me insurance, and you're providing me healthcare, or the face-to-face healthcare. It's not the way that it's the machine that's set up. Neither of you want me not to utilize each other.
Yes and no.
So you guys both benefit from me being sick.
No, we actually...
And you want to get rid of me. Like, you get what I'm saying? Like, and you should want to get rid of me as a client per se.
I get what you're saying. And I will say healthcare in general is moving towards what we call value-based care,
Yep.
where you're paying for outcomes. You're paying for being less sick, or you're paying for the drug working, not for the tests that you run and all those things. So I do think what you're saying makes sense in that it has been that way historically, but I do think it's slow progress, but there is
Parental
progress.
rights.
No, in the sense that sort of, right? And I think that's probably the biggest thing of this conversation is like all of it's right and all of it's wrong, right? Because like lifestyle, the way that I like to think about it is lifestyle prevents disease. So yes, everything you're saying,
That part right
natural
there.
remedies, working out, 100%. But
Absolutely.
Where's the balance?
once I have the disease, I'm going to use treatment.
Right.
Okay, we're getting somewhere.
And yes, and here's the thing too. A lot of it does fall on the patient, right? And that's why I mentioned earlier advocating for yourself, because yes, she's absolutely right. There are physicians that want to help you. They want to make you better. They want to get you out the door. Come to me when you need me, but also come to me when you don't need me, just to make sure that you are where you need to be. You know, like for example, your PCP, primary care physician, right? Come to me once a year just to make sure everything's where it needs to be, you know, but and the system is also working against physicians. I think that's a whole different podcast that we can totally get into.
I don't know if I believe that, because if we go back to the original statement that Nicole was saying earlier today,
Yep.
the only way the doctor survives in their practice or their business is pushing volume.
But what do you say?
So the way that I feel, and
that's not wrong, by the way.
And this is what I told my primary care doc, well, not the one that I have now, but the one I had before when I used to live with my parents. I'm sure I offended him. I told him, every time I come into your office, I feel like cattle. I'm a number. I come in and you're quick to prescribe medicine to me because that's how your business survives. And I have a problem with that. And I used to tell him, I don't want you to just come. I don't want to come to you to just get medication.
Right.
And that's the way that medicine feels like it. So what I'm trying to say is that, and I am trying to push back.
Yeah.
Sometimes I don't feel, the way that medicine is practiced right now, I don't feel like doctors have our best interest right now. And
that's valid.
I see
valid.
why you feel that way.
Yeah.
I do. I see why you feel that way.
So it's like, how do we balance? Because rather than the doctor telling me, well, you're not working out enough, your diet is not good enough, why is it always a solution to throw prescriptions to a patient?
I guess the other like argument I'll make to this is that what every doctor is doing?
From my experience.
Right.
And I've had, what am I, number 4 primary care physician?
Because I'm quick to change.
Right.
I'm very quick to change.
And I do think that is...
And they're incentivized, by the way. I'm not saying that it's their fault.
Oh, yeah. No, I know.
It's
100% I
there's
get what
money
you're
to
saying.
be made.
Well, spending 45 minutes discussing preventative strategies versus a 15-minute procedure, which one do you think pays more?
Right.
The procedure, 100%.
So and that's doctors trying to sustain their practice, trying to continue to care for people. So I'm with you in what you're saying. The point I was going to make was, I think it depends on your provider though, and on if they're part of an integrated health system. It depends on the practice too, because there's something that
I can't wait to get to the business side of it.
In the biz.
I think it's gonna put it into perspective, because I do have an argument against myself. So go ahead and
I love that for us, by the way.
Get that part out, because I'm gonna side with you in a second.
Okay. Well, in the biz, right? Polypharmacy is what we call when someone is overprescribed medications. Polypharmacy. We have initiatives and government regulations that try to decrease polypharmacy. So I do think for a long time, providers were overprescribing, but I do think there is some correction happening to that too.
Yeah.
As of late?
Yes, as of late.
Yeah, because I've gone to some places where people are gonna get surgery and they come with a Ziploc.
Oh yeah.
Full of medicine.
Well, as someone who has had a couple, no. And I'm gonna tell you from surgeries I've had in the past to the most recent ones, right? Oh yeah, in the past I used to get like 28 oxys, easy, 28.
But that's one.
Yeah, but in comparison to today, if I get 10, I'm lucky. I'm lucky. And once the 10 are up, I have to be evaluated before I'm prescribed anymore.
I see what you're saying.
There has to be a very good reason as to why I'm getting prescribed more, because going by the diagnosis and then the procedure and then the medication, it has to make sense for them to prescribe. So there's way more that goes into it now versus, like what was done in the past. Because before people would walk out with Ziplocs, oh yeah, I'm going to give you some Valium and here's some oxys and here's,
I mean, the opioid epidemic can be its own.
I mean, that is its own podcast for sure.
Yeah.
But yes, those changes are underway. I mean, could they be quicker? And yeah, sure. But everything's a process, especially when it comes to healthcare.
And one other point that I want to make, sorry, I know you were trying to.
There's so much to
I
cover.
know. I think we have to call out that the distrust in a marginalized community is more, and it's okay that it's more, because look at history. Do you guys know what the Tuskegee study is? Have you ever heard of this?
I have.
So basically, Black men were withheld syphilis treatment to see what the outcome was. So of course, anyone who has had, and it's Latino communities have been, it's happened to them. I don't know specific examples, but similar things where, of course, that distrust is going to be there. And it probably makes sense for Italians because we're Caucasian B.
Yeah.
So I have to credit Eric D'Alessandro for that. One of my favorite comedians. We're white, but we season our food.
That part.
I love that. So so yes, I'm gonna start working against myself now because
I'm gonna sip wine.
I do think there's a balancing act, and this is so layered. Like we really can make this like a 10-part series at this point.
It's my favorite topic. I probably would say Nicole's too. We could go on and on about it, but you're right. And I think maybe we would make a part 2.
I think we will. We will. Because here, for us, I think it's one argument. For our parents, I think it's a different argument. So here's where I tend to agree with people, and the ones that are like, I am against this healthcare and they're not trying to help you, this and that. And it's what she was saying earlier. It's the advocating. And for me, and I almost it hurts I don't want to cry. It really hurts me to see how a lot of the senior population in this country, they don't advocate for themselves. They just say, my doctor said, and that's the end of it.
They're an authority figure.
So how I have a hard time understanding how doctors are trying to do right by patients. And this is specific to and it's not to put blame on anyone, because the way that we're set up, some of us don't have time to go to the doctor with our parents. I don't have time for it.
Yeah.
So it's hard for me to say, well, mom, you need to advocate for yourself.
Sure.
Where people that are in a socioeconomic place where they can go to the doctor with their parents, they could be like, and push back. You know what I'm saying? Or give me a little bit more understanding to why you think that.
Yeah, because my mom is that person.
You know what I'm saying?
My mom's like, yeah, we got to talk about that. So I'm not going to take that. I'll take it, but there has to be a very good explanation for it.
Right.
My mom has high blood pressure. It's the only thing that she has going on. She's a very healthy woman. So it is, oh my God. I was trying to give her, just for some context, she had a rotator cuff repair, shoulder. And, I brought her home, 6-month period recovery because she needed the 6-month PT sessions. She took her medications because I forced her to take, I would literally stand over her, and because she can't do anything, she had no choice but to open her mouth and take the medication. 3 months down the line, obviously, she doesn't have any more of, the pain meds. And she's really having a hard time sleeping because it's really bothering her from one of the PT sessions that were pretty intense. She can't sleep. I'm trying to accommodate her. I'm like, Mom, let me give you a Tylenol PM. Your doctor said it's okay. She goes, nope. Ma'am, Let me give you a Tylenol PM. Nope. A Tylenol PM. It's a blue pill. And she's looking at it. She's like, why is it blue? I'm telling you, my mom is that person. She's like, why is it blue? I take Tylenol when I need to take Tylenol. Lies. She doesn't take a damn thing. If she has a headache, she'll sleep it off. She'll drink water with lemon because of the antioxidants and the properties that lemon carries. Right, ma'am, take the damn Tylenol. You have a headache. Like,
well, and I would argue like that's fine to do both.
Right,
Use the
absolutely.
lemon.
But like he said, it is too. But what the hell does a lemon have to do with the headache?
Yeah.
Right. And I'm very much
The mind.
I advocate for myself with my physicians. I ask questions. I do my research. I immediately call my sister. Immediately. Sadie, this is what they're giving me, recommending, saying, here's my images. We dissect it ourselves, right? You would think we are like the surgeons or something, like the way we go into this, right? Before we make an actual decision that's going to lead me to a procedure. But we get that from my mom. My mom questions it all. And I think that's great. But that also can be very detrimental because, again, she's here dying of pain. She's on the verge of tears, but she would not take the Tylenol PM until I, of course, got over her. I opened her mouth. I stuffed it in there and I made her take water. She's cried laughing at this point, but something's got to give, right? But she's that person. So she will question everything. She wants to know why you want to do certain procedure. What are the outcomes? What does medication and recovery look like thereafter? How long is she going to be down? So she does her own level of research, but she's also very much into natural medicine, and with good reason, because with what she knows and how we grew up as well. We grew up with an Adventist doctor. We grew up Adventist, Seventh-day Adventist. We grew up with this Adventist doctor who is very well known, not only in the Adventist community, but outside of it as well. He's cured cancer patients. We've seen it ourselves, right? But he wasn't always a naturopathic physician. I want to say he was initially a primary care physician. Don't quote me on that. I was really little. I can't remember. I'd have to touch base with my mom, but and we still keep in contact with him. But he completely transitioned into a naturopathic physician. And the level of
and it works.
And it works, which is the most fascinating part, which is why I am very much, I'm not even 50-50. I'll probably say 70-30, 70 more towards that. And I'm probably being, generous with the 30. I'm very 70-30. I'm very much on the natural side of things versus, Western medicine because of where Western medicine is today. I understand that there are some things that are underway. We're trying to make necessary corrections, but again, at the end of the day, it pays, and it goes very much in hand with big pharma. It's a business at the end of the day. You know what I mean? So, all that to say, yes, my mom is that person, and she will question till the ends of this earth before she takes a Tylenol.
You
Much
gotta
less.
convince her.
You have to convince her with proof that this is not only going to be temporary, but that it works and that is better than her method.
So that's like over advocating.
Right.
Yeah.
Right. There's so many things I want to say. First off, I would say like my family, same thing where they question a lot, but because they view the doctor as like an authority figure, they just say, okay, and then they go home and never take it.
Yeah.
I would say that's kind of what it would be like, sure, yes, I'm going to do that.
Funny
I'm going to please you.
My mom
and then,
does that too.
Okay.
My mom does it too.
Yeah.
Okay.
When she sees that the doctor, sorry to interrupt you,
No, it's okay.
but when she sees that the doctor is insistent, she's like, okay, fine. Yeah. Prescribe it. I'll
Yeah,
go
all
get it.
Right.
And she won't get it. And I'll pick it up. And she's like, yeah, you can put that there.
Yeah, you don't have to pick that up.
you don't have, you can leave it right there.
Yeah.
So she does that too.
Yeah.
So what mine does is that she takes the medication, but she self-prescribes herself. So if the doctor indicates her to take it once a day every morning, she'll only take it once a day every morning when the symptoms are there and she wants to get rid of them.
Yeah.
Right.
So talk a little bit about how that can negatively help your point and how we should trust the health, because I'm having a hard time right now.
Because I think if the doctor sat with you and explained to you that, or any provider explained to you what the risk is when you only have symptoms, you would have a better understanding and you would know why they're they're making that recommendation, right? So I think that I think it's a lack of discussion and understanding. I think it's
I agree, but with you, by the way.
Yeah.
Doctors don't have time to sit
They
down
don't
there
have time
and
to do
hold your
that.
hand.
because when you're not right, exactly. You need to and decisions should be shared, or medicine should be shared decisions. It should be a discussion between the patient and the provider of the patient saying, this is what I value.
Yeah.
Does this treatment align with that or not?
Right.
Right. So you should be moving towards that shared decision making, but that's not what they're incentivized to do. And I think that's where that shared decision making became very relevant in a lot of the vaccine rhetoric and things that have happened this year, because there is such a mistrust in the doctor, because the doctors are making those risk benefit ratio calls themselves. Really, every medicine, every treatment, every procedure has a risk to benefit ratio.
Yeah.
Which one outweighs, and that usually guides your decision. The patient should also, most of the time, have a say in that. Historically, I don't think that happened. I think the doctor made the call.
Yeah.
I don't know. Can I push back to
Sure.
that? So I think there's times, and this is why our healthcare is so broken, that either myself as a patient or the doctor would make a recommendation, or I would make a decision. And then here comes insurance over here, and they're like, nah, you good. We're not going to cover neither of those
For
two
sure.
options. And then we come back to the script.
Yep.
And
Absolutely.
you get what I'm saying? Like, what's going on? And how can we fix this?
So that is, when it comes down to insurance, they are trying to get to what the most clinically right thing is. That's also the most economically conscious.
Right.
So you have competing forces sometimes.
Yeah. And it's frustrating because at the end of the day, what they want to see is that it is medically necessary. Dude, if it's medically necessary, let it be. Just approve it and cut it out, right? Like, it's medically necessary. That's what you wanted to know.
Right.
Yep.
But like Nicole said, what's more cost effective though? If, for example, someone who we all know Ozempic is just the wave right now, right? And it has been for a bit for weight loss. I'm not gonna lie, I so went to that. I was so desperate. I was incredibly, incredibly overweight. And it was to a point that it was even affecting my hormones. I'm having dark circles around my mouth, dark patches on the side of my face, on my forehead, on my neck, insulin resistance. So I was desperate, and I said, yep, I'm going to go. I was immediately denied. You have to have been of a certain weight, but also considered a type 1 or type 2 diabetic. And I was none of the above. I was just overweight and I needed to get it together. Right. I have a friend who also went. This person did get it approved. She got it approved because she was type 2 diabetic, or maybe pre-diabetic, something along those lines. But also her weight was significantly higher than mine. Height also played a part in that. But she also had to fight to get Ozempic approved, because they kept coming back like, yeah, metformin. It's astronomically different in pricing.
Yeah, metformin's pennies.
Literal pennies, right?
To Ozempic compared to
Yes,
Ozempic?
absolutely.
No, just pennies.
Yes,
Metformin's cheap.
It's very cheap. Like, it is why it's the go-to for insurance, because it's so cheap. Absolutely. You get metformin. Everybody gets metformin if they want it. It's literally just a prescription. Usually doesn't have to go through an extensive process like prior authorization. Get it prescribed, get it at the pharmacy, pennies, compared to thousands, because Ozempic is thousands. When you start a lower dose, or like Zepbound, you start a lower dose, you'll start with the lower
0.5.
cost.
Yeah.
Like, $200 something, unless you're going through a third party that has some sort of contracting. That's a whole other conversation, but that you could get it a bit cheaper, but you're not going to pay nowhere near what you would for metformin.
Insurances were only allowed to do that because the guidelines recommended metformin therapy first. That is not the guideline anymore.
Right.
The guidelines have evolved.
Yeah,
So
quite a bit.
Data takes a long time.
Yeah.
It changes. Medicine is constantly changing. And I think that's probably the other thing that's a really big misconception is when people are like, well, they lied. They didn't know, right? Data, the one thing you know in medicine is that everything's going to be consistently changing. I remember when blood pressure goals were 130 over 80, then they went to 140 over 90, then more evidence came out, it's back to 130 over 80. It's just what you learn in that time.
When did it make it to 130? I thought it was 120 over 80.
See, right.
What?
Like, so
I remember,
as evidence comes out, they make new recommendations based on what we've learned.
I'm okay with that. And I
Yeah,
love
but
that.
yeah, but that also scares me sometimes because
Why?
Because, you know, like she said, 140 over 90, 130 over 80, you know. Historically speaking, 120 over 80 has been the norm and what you want to stick to, right? But now we're playing a part as to, oh, well, maybe that's your baseline, right? But that doesn't necessarily mean that, you know, you don't have, you know, a blood pressure issue because, you know, my mom, for example, my mom's blood pressure is never 120 over 80, like never. My blood pressure is never 120 over 80. My baseline is typically 115 over 75, 110 over 68, in that realm, right? She has high blood pressure. For a while, it was, you know, it was pretty much 128 over 85. And it will stay there for a while. But then when her blood pressure started to climb a bit, she was pretty consistent for that of about maybe 3 to 4 months in the 130 over 90s. And so that was her baseline. And I started to question her cardiologist, like, okay, so is that normal? And he's like, well, for her it is, right? But that, I didn't understand that. Like, for her it is, but, you know, it would get a bit higher. And he's not necessarily worrying about it because it's just a little higher than her baseline. You know, so for me, it was like, okay, so where do we draw the line then? When she has a heart attack?
There's also differences between diagnostic and treatment, right?
Yeah.
So for your mom to get diagnosed with blood pressure or high blood pressure, that 120 over 80 classified it. Once we know you have high blood pressure, we try to keep you under 130 over 80. Let's say I'm using examples.
Yeah.
So I think that's kind of a nuance too, that it comes back to, again, education.
Yeah.
And to your point, yes, I and with the blood pressure part too, is each disease is different. Having high blood pressure for a long period of time, really, I always talk about this with diabetes too. Having one high blood pressure or high sugar reading is okay.
Yeah.
Having high sugar for 10 years, that's when damage happens.
Right.
Where if you have an infection and it's really bad today, we have to take care of that. Right? So each disease is a little bit different too.
Yeah.
That's good. I like that. I mean, oh my God, there's so much.
There is so much.
There is so much. Look, I'm ready to talk about the money.
Can I say one more thing?
Yeah,
and then
I'm
we
ready
can go
to
to the
talk about the
money?
money,
Because I want to go back to the natural remedies for a minute.
Yeah.
Yes.
Natural remedies.
Which is where I would push back a lot, by the way.
Yeah.
But go ahead.
Yeah. No, because but I think you're going to like my point, actually.
Okay, go.
I actually do. If you talked to Nicole right out of pharmacy school, it would have been like, natural remedies are stupid and like, oh my God, we have to look at the evidence that's there.
Yeah.
Natural remedies are not FDA approved because nobody has spent the money to study them and to submit them for FDA approval and to be regulated. Doesn't mean they don't work.
Yeah.
Right? However, here's my pushback.
Okay.
Because they're not regulated, you don't know if what's on the bottle matches what's in there. So if you go for, this is my PSA, if you go for a natural remedy, you want to look for things that are USP verified. That's a set of basically like standards that natural products will adhere to that says what's on the bottle is in here.
Right. I agree with that. I'll never push back on that. Yes, please. So much so that my
third party tested. That's what it means.
Yeah. And that's one thing that, I mean, you've heard me say that a million times.
Oh,
I don't
Lord.
Yeah, I'm very critical about the things that I bring into this house.
Look at his laugh.
He knows, like I'm so ridiculous when it comes to
I
it.
appreciate it.
Yeah,
I just don't got the time and energy for
Yeah,
it.
like I used to have plugins, and my sister wanted to die because she's just like, "Oh my god, your endocrine system is hating you right now." Okay.
What is that?
Your endocrine system is, your reproductive system is about to shut down in about 2.2 seconds. Okay. You just killed all your fertility. Right. And so but we are really, really anal about that. Like we're so ridiculous about, in a great way. Some people really do think it's ridiculous. I don't care. Because it's true. Like there's so much crap in everything. So I do read, I read everything that we bring into this house. I don't buy fruits that are not organic, for example. Avocados, for a while I would buy, or they have to be organic, but the thick, skin of it protects it from pesticides. You just want to make sure you wash it before you cut into it so it doesn't get into it actually. So things like that, right? I'm really, really anal with stuff like that. I'm like that with natural meds as well. Not only third party tested, but even the manufacturer. What do they believe? How did they start? How long have they been running? I literally, my sister may be a bit worse, but we are those folks.
Well, just because it's natural medicine doesn't mean it comes without risks.
Yes, it doesn't mean, yeah.
Vitamin
of
A
course.
toxicity is a real thing. If you
Yeah,
take
it
too much
sure is.
vitamin A, you're losing your hair.
Absolutely. Absolutely.
So to me, it's the same thing, risk and benefit. It's
Yeah.
just not regulated the same way.
Yeah.
So you have to do your extra due diligence.
Yeah, it'll be my pleasure. Absolutely. I sign up. I consume it.
I do have a question about natural
Please.
remedies, and because that's a business too. In Whole Foods, the amount of, what are they called?
Supplements
That are available, readily available to you, are a lot. And just how people are ready to throw a prescription at you, people are ready to throw 25 different natural choice, products and supplements down your throat.
Yeah, like the wellness industry, that like natural wellness industry, in my opinion, is just as toxic as everything happening.
Oh,
in
absolutely. It
healthcare.
could be.
That's
Absolutely.
a hot take.
It is a hot take, but I agree with that.
Please
It could
talk
be.
a little bit more about that.
I'd
'cause
rather roll my dice with that though.
Wait, but I've never heard that before.
Oh yeah.
So I have a question then. How regulated? You answered that already. Pharmacists or scientists, how involved are they, and why is it so toxic, or can be as toxic to go down that path?
Because you have a bunch of influencers who have no medical training
True.
saying this supplement that I don't know if what's on the bottle is in the label, right? Got rid of my PCOS. So you have these women who are like, look at this person. They got better. It's anecdotal, right? It's not studied in big groups of people. It's anecdotal. It helped this one person. I'm going to do it. But maybe I'm on a blood thinner and it interacts with that. Right. So there's that issue of not consulting healthcare. Where I think it's more toxic, though, is that a lot of those wellness influencers, or not even influencers, some of our government that own wellness companies, they are saying it treats, it cures. You cannot say that. The FDA will fine you for that. So
Yeah.
they're trying to make their own money in it.
Yeah, because
Do you see what I'm saying?
I do see it in a lot of these bottles where it say it may.
Yes.
Yes.
'Cause
They
you
are
can't-
not
yeah, you
allowed to
can't give
say
a guarantee.
cure, treat. I forget I used to know that.
But then that defeats the whole purpose of the natural remedy argument.
Well, not necessarily.
Because if I'm recommending to somebody to build up their immune system to take vitamin C, in my mind, obviously over consuming anything is bad for you. But in my mind, there's no harm to tell somebody to take vitamin C. You get what I'm saying? But if they're going to a store, because I don't want to say names, like or get sued out here, and you get sued for anything at this point. If they go to the store and they could pick up a vitamin C, they don't care what brand, what nothing. It's just vitamin C. They could potentially be consuming chemicals.
Which
Correct.
is exactly what she's saying. Yeah.
Correct.
What?
Correct.
Which is why I'm so ridiculous about, any like, for example, the supplements that I take for cold,
scary.
like cold.
Yeah, but
it's very scary.
This
It
is
is.
this is
And
why I
much
get so heated when people get on pharmaceuticals, because I'm
Yeah.
like, there is a whole unregulated thing
1,000,000%.
happening here
Yeah.
that no one's even paying
I
attention
have to agree with that. I have to agree with that. Because for the longest, I was taking
He's shook.
No, yeah, because now, it's hard for me to say this. I'm starting to lean towards the drugs.
you wilding out.
I'm sorry, but hear
But
me
let me-
out.
but-
But hear me out. Hear me
Nicole said,
out.
yes.
Yeah, but hear me out. Yeah,
Can you tell my boyfriend this?
No, because
Oh.
because now I want to lean towards the stuff that has the more studies on
Exactly.
it. And the things
Yes,
that are being
but that doesn't
tested.
necessarily negate the fact that natural medicine is not being studied.
Correct.
What she's saying is when you do go the natural medicine route, you need to make sure that you're going with a trusted company. By trusted company, meaning that they are being tested to ensure, to confirm to you as the consumer that what I told you is in this bottle is what's in this bottle. And that's right. You do want to confirm that, which is what I do.
But it's twofold. It's what you're saying,
Yep.
but it's also that there is evidence that natural supplement works
Yes.
and has limited safety risks, right? Which that sometimes we don't know
Yeah.
with natural.
So I'm not going to bother myself on that. I'm going to call my sister.
All I'm gonna say is that people are gonna be in the comment section. This poor man, this poor.
First
he
of
is
all,
so conflicted.
and that's okay. But how often do you get sick?
the way that I choose.
No, but answer it first.
Not a lot.
And when you do get sick, how quickly do I cure you?
I would like to give my body more credit for that.
Listen, we'll talk about that at a later time because you'll be talking like this and be like, I'm not sick. So we'll talk about that at a different time.
But
he'll be sneezing, coughing, bleeding, whatever. It's mental, is what he says. So let's leave that one for another podcast.
No, to a certain extent, it is mental.
Yes, but I'm not talking about that part right now.
And
how quickly do I cure you? Answer the question.
Quickly.
Very quickly.
Quickly.
With what?
Both.
With my mat. Yes,
Both.
with both. Hold on a minute.
Both, babe. It's both.
It is.
It's
but
both because it's what
but
you.
wait,
it's what you ingest.
So
and
let's
it's
take it
also
to last week.
The medicine.
Pause
that you
it.
take.
Pause real quick. Let's take it to last week. Last week, you're starting to get sick.
Let's not get too specific.
No,
here.
we are. We are, because I'm going to prove this.
This is public.
Last week, you were starting to get sick. And the first thing he said was, babe, you got to give me that concoction that you do,
She does.
because I'm starting to get sick.
What is the concoction that you give me?
It is, well, I don't want to say the name, but
Oh, okay.
because again, I don't know what
Is it natural
It is
or is it-
natural. It is
okay,
completely
okay, so it's
natural.
natural.
It is third party tested. I do have to check if they has that label because now I'm interested.
Yes.
I would say that I don't really look for the label, but I do my due diligence to make sure that it is third party tested, and to make sure that it is actual, that it does work. And when I say my due diligence, I don't do crap. I call my sister because she is 10,000 times worse than I am. Why would I do the work if she's already doing it? That said,
And I get lots of calls of, hey, have you heard of this? What do you think about this?
Yeah.
Can I take this? And I'm
Yeah.
happy.
that
do
said,
that for the people
one
in
of
my
them
life.
is, and what's crazy is that these supplements are all made out of fruit and vegetables and roots and just everything that's natural. Everything you read on the bottle, you understand what's in there. So there's nothing you don't understand, which I, number one, love. Two, I also look for when I'm grocery shopping. If I can't read it, I don't want it. Because what the hell are you putting 6,000 different things in something that should be as simple as pasta? So one is called Rapid Rescue. It's not the brand, but it's called Rapid Rescue, and it has a ton of. I probably have a picture of it. The other, and you have to take 3. It's that with zinc and calcium. Oh, not calcium, excuse me, vitamin C.
And it works.
It works like a charm.
And
So
there
much
is
so it made me look like a
evidence.
liar at work. I could not stand up. I had 103 fever, went to the urgent care, got paperwork and everything. And and I had a speaking engagement for work.
Oh my gosh.
And 48 hours later, I missed the professional development day that I was supposed to be a part of because I could not get out of bed. I call my sister. She's like, you have to get this stat. I get it. 48 hours later, I was at the event.
Wow.
And I was not even so much as blowing my nose.
She could have said ASAP. I just want to sprinkle that in there. Because what's a stat?
Oh my God.
The only stats I know are batting average,
Dear
home
God.
runs, RBIs, points, points.
I can't.
You know,
It's like
that's
that
the
with
only stats
it's
I
like that
know.
with everything though. With
No,
everything that I say.
I know there's somebody out there that knows what I'm talking about. That these people in healthcare, they just don't. Look, at this point, I think we could get the crowd to start putting in their questions to X amount of like health concerns or drugs or whatever, and we can make segments just answering people with you too.
Agreed.
Because
that'd be fun, Nicole.
That would be
I
fun.
subscribe.
So now I find myself where I lean to both.
But that's the thing is that
And
I
I'm
am
okay with
also
that.
very much
Yeah.
both. You know, I am very much a believer of Western medicine to a certain extent. I'm very much a believer of natural medicine to a larger extent, right? But I do believe in both, you know? My sister's an RN, my best friends are RN, you're a pharmacist, you know what I mean? So my life revolves around medical everything. I've
Look.
been in the healthcare field for 16 years, you know? So everything that I love around anything is medically, you know, inclined or related.
This is why it's so important. And I hate that people are out here leaning only on AI and stuff like that.
Agreed.
This is why it's so important to have a community.
Oh my God, yeah.
This
But
is
also
why, this is why community is so
information is at your
important.
fingertips, for the love of Christ.
But so is misinformation.
1,000,000%.
Right.
But that's what I'm saying. Don't just go to, first of all, before you go to Facebook, Instagram, X,
Google.
Threads, or whatever it's called, there are still books. Books exist. It's good to read.
That takes a lot.
That takes a lot.
That takes a lot. That takes a lot.
Stop
Well,
it.
and
Stop
that's
it.
this is what scares me with AI. I am not against AI by any means. I think it's
I'm not either.
I think it's a necessary, like, we're going to have to adapt. I think people who excel, the people who are going to succeed are going to be the ones who know how to harness and use AI the best.
Yes. But also you use it responsibly.
I really
but
do.
responsibly,
Yes.
because, and that's what scares me with health, with all of these people asking ChatGPT their
Their
symptoms,
symptoms.
this, that, what treatments.
Yes.
These algorithms tell you what you want to hear.
Yeah.
You still gotta, and some open evidence, I think it's called, is a like a medical one.
Yeah.
It's great.
Yeah.
It can pull everything that you need, but you can't just copy and paste it. You have to interpret it and still humanize.
Yeah. I will say though, AI did pull something scary, and which is why I said you have to be all the more careful.
But she prompted well. I know where you're going. She prompted well. And
Yes.
I don't think you should expand on that. 'Cause
I
don't
won't
want
expand.
hate.
No. I definitely won't expand on it. But I know of someone who had been going to a physician for quite some time, and every physician she went to or switched to of the same specialty would come with the same conclusion. It would end up in a procedure that was just detrimental to this person's health. This person was exhausted. This person said, I've had enough. This person is also in the medical field, very heavily involved in the medical field. That said, this person was like, you know what? I wonder what ChatGPT has to say about this. This person prompted well, provided all the information absolutely necessary from a medical and natural standpoint. And this person healed themselves.
Isn't that crazy?
And what it is this person is very close to us. So we know that we have been following the what's it called? What's that word? It just escaped my
The progression?
Yes, but there was another one.
The timeline?
No, well, I guess you could use that. We've been following it, right? The entire, from the diagnoses to the treatments, to the procedures, to the tears, to the exhaustion, to everything, to then end up with AI letting smart on AI is like, listen, I ain't a medical professional.
Yes, it's always like,
And
I
it's always
can't
like,
diagnose.
I can't diagnose. However, you should probably try this, that, and a third in this order for this amount of time.
And people can't lie on AI. AI tells you that after you ask for
Yes.
Oh, yeah.
Yeah, absolutely. They're not trying to get sued.
So the people that be like, well, that's what it's saying.
But that's also a
do.
slippery slope, to your point. It is a slippery slope because yes, that did work. And I was just stunned,
Yeah.
shocked, like flabbergasted. I couldn't believe it. I was like, did this really happen? It did. So, but it can be a double-edged sword. So we do have to be careful with that because there are folks that do have much more complicated conditions and you really shouldn't be relying on. I mean, I will slap somebody silly if they're talking about they have cancer, looking up
Right.
You know what I mean?
And
I'm not, and again, I'm very much a natural medicine aficionado.
Advocate.
And I would advocate that to no end. But I prefer you going to see a naturopathic physician than ChatGPT for a cancer treatment.
Well, and what I was going to say too was, I think what we've talked about today, you learned you have to advocate for yourself in the healthcare
absolutely
system. So if AI can help you do that,
sure,
great,
yeah,
right, great.
Yeah.
Hey, I think I have this.
Yeah.
Can you make sure I don't have this or whatever?
Or I went to my physician and I said this, that, and the third, and they're not listening to me. What is your suggestion for me to kind of combat them a little bit on this?
Right. How do I address this? Yeah.
What should I say? Should I change physicians? Should I look for a second opinion? Absolutely. Use it responsibly. Yeah. Don't use it to do all your homework.
Right.
All your papers, because, that's how you stay stupid.
Look, I'll admit I'm not the best advocate, and I think a lot of men can align with me. We don't like to advocate for ourselves. We like to be more transactional when it comes to our healthcare. Again, the way that I like to handle healthcare, specifically with doctors, because again, I feel like I'm cattle when I go into a doctor's office. I have a problem. I'm happy to lean on the science and the prescription and the drugs of it to help me get on the right path. But for me, it's always about how can I get in and out and come out not having to lean on medicine or prescriptions.
And I think that's fair depending on the diagnosis.
Yeah, that's what I'm saying. I think there has to be a healthy level or...
Yeah, because so using the blood pressure example, right? At some point, diet may not be enough. Cutting salt out of your diet may not be enough.
I have a hot take on that, but that's going to be a different day with the sodium.
With the sodium. But, whatever. That may not be enough. You may always need to rely on medication, but I think culturally it feels like a failing.
That's fair.
Yeah.
Because it's tough for me to put in all the work, to work out, to have a healthy diet, to not drink, not to consume sugary foods or carbs, and not to get the results that I want or that I think that I deserve, better said. And then that doctor to say, well, guess what? You're still going to need this high blood pressure medicine, which to be vulnerable is my issue. I have issues with high blood pressure, and I haven't been able to beat it to a point where I don't need, because I have a low dosage, but I still need the medicine.
And something that I used to educate my patients all the time is because you have these preconceived notions of I shouldn't need medicine, I should only need one medicine, etc. Blood pressure in general,
Genetics.
each medicine only lowers your blood pressure about 10/5. The majority of people on blood pressure medications are on 4+.
I didn't get that.
4 medications.
4 different types of medication for blood pressure.
Good.
You're on nothing if you're.
Thank you so much.
But
I appreciate that.
does education change your perception of it?
Yeah, but also to give yourself some credit, right? Because after the weight loss, he was on 2 different medications.
And now you're on one?
On one.
That's huge.
It's huge. It's huge.
Again, the way that I advocate for myself is I want to not have to defend it.
And that's the
goal. Depend
goal.
on it.
Yeah, that's the
my
goal.
My goal. So yes, I want to take credit for that. But in my mind, I have insurance and I have the healthcare system there for when I need it, and I don't want to depend on it. So in my mind, and correct me if I'm wrong, it's not a win because I am still depending off the medicine to be in a normal.
I understand what you're saying, but I think that just your perception on that
is a win.
Needs to shift because we have evidence and medicine that others never had to live longer. That's how our life expectancy has gotten so far, right? So I'm sorry to break it to you, you're going to need blood pressure medication probably the rest of your life.
Right.
And that's it. Why wouldn't you use it if it is, because blood pressure medication decreases your risk of stroke, of heart attack, by like large percentages, 80, 90%, right? So if you have something that you don't feel that can help you with that, why wouldn't you take it?
I take it. And my thing is that my goal is always to get off of it
But why if it's working?
because I don't want the dependency of the drug.
He wants his
Why?
body.
So
he
in
wants
my-
his body to do the work.
Exactly.
The way it should do the
So-
work. The way it was designed.
So in my
for it to do the work.
my mind, and I think a lot of people can relate with me, and I agree with you. There is a potential that I might not be here if it wasn't for the
Right.
drugs. So I do lean on the drug. That's why I'm like, I do
You're
admit
taking it.
I know when to draw the line and where to lean on it, but I want to get to a point where I could naturally be healthy without the drug. So in my mind, it's not a win. It's a win because the medicine is helping me and it's keeping me alive, but it's a loss because why isn't my body doing what it needs to do? And I'm putting in the work and it's still not. Is it DNA? Is it like it's
I
something?
mean, genetics does play a part.
It has to, I'm sure at this
It
point.
does.
Yeah.
And I've gotten to a point where I just tell myself that it's like, you know what? It just runs in my family, which it does.
It does.
My brother that passed away already, he had a stroke. He was he had a high blood pressure. My father had a stroke. He passed as well. You know what I'm saying? Like from my mom's side of the family, it runs, and diabetes on both sides as well. So it's like everything is against me. I'm putting in all the work I need to put in. Granted, I'm doing great because it's true. I only use one medication at this point. Like it's for high blood pressure. I don't take for cholesterol, thank God. And my cholesterol was high when I was overweight.
Yep.
So all that said is like, yes, like and for the people out there, obviously, like you need to do your part. Like it's not you just going to the doctor and them being that authority figure, how you said. It's also me coming home and making smart decisions for myself
Totally.
and changing the way that I've stopped drinking, Nicole, is like
Yeah, astronomical difference.
Like the way you used to drink juice, right? Is that what you're getting at?
No, alcohol.
Oh, alcohol?
Yes.
Alcohol.
Because I feel like you drank a lot of juice too, right? With the sugar.
No, because now I drink pressed.
Yeah.
Press. Okay.
So it's not. It's
That's
like,
okay.
you know what I'm saying. So
natural sugar.
if it has sugar, it's natural sugar. It's not your artificial sugar.
Okay.
So if it's not natural, and it doesn't, this is how I've shifted the way that I live my life, and this is how I see foods, and that's a whole nother thing. Like, because again, the science has changed a lot when it comes to food. If it doesn't come out of the ground, I prefer not to consume it. That's the rule that I like to live that's the new lifestyle that I'm in right now. I know she could be proud of that. And it's helped a lot.
Yeah.
It's helped a lot.
Especially with our weight loss
And
journey.
You know what helped a lot? If people want to look into that, if you go to Netflix and the one with Zac Efron, I think it is.
Yes. Oh, I
What is it
love
called?
that show. Hold on.
Can you look it up? Just look it up. So that show, and it kind of leans towards the whole natural remedy type thing. But guess what? There's science behind that too. It's all science. Like, but drugs or the pharmaceutical side of it, it's the same difference in my opinion. They're just taking, and correct me if I'm wrong, the components from these natural remedies, and they're making it more efficient in the way of, we're going to take whatever the medical term is for whatever, and we're going to make it a lot more effective by putting all those components
Down to
together. Oh yeah, that's the name of the show, Down to Earth. We're going to put them all together, and now we're going to deliver it in a way that's a lot more efficient for your body to consume.
Correct. Exactly. They're taking they call it the active pharmaceutical ingredient, which can be from all types of natural medicines and things like that.
Right.
That they then either, they pharmacodynamically make it so that your body can ingest it, and it, there's the lowest risk of side effects and blah, 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 blah. But it all comes from.
So, and I think that helps me cope with it, and it helps me understand it a little bit more because, for instance, iron, right? Beets have a lot of iron. So help the listener understand, how does, I don't want to call, what are they called? They're not
Deficiency?
called, no, how do you call it? They're not a factory, but the places that make these medicines.
Oh, manufacturers.
The manufacturers, how do they create iron, and how do they put it into a iron pill so that we can consume it and it's not detrimental to your health? And if you can, give me that example to a company or a manufacturer that's responsible and is doing it the right way. How do they take from the ground, process it, put it into a capsule, and deliver it to the masses without it being detrimental to your health? If that makes sense.
It does. I'm going to do my best to answer this I think I can answer this. So research and R&D from pharmaceutical manufacturers is doing exactly that. They're taking ingredients from the earth, wherever, isolating them, studying them, running research and design before it's put into any animal, any human. They're isolating it, studying it, learning it, right? Then sometimes you'll have like they call it like a vector of the way that the drug is delivered. Sometimes that's pre-made and you can kind of make them together, right? We're like, oh, we've used this delivery system of this pill before. We can use it with iron. Sometimes it's new. It depends. They then make what they think will be sustainable in humans. That's both efficacious and safe. And they apply for an investigational new drug designation from the FDA, that the FDA says, okay, there's enough research that we think you can start testing this. They start, and then there's different phases of trials. Phase 1, I believe, is I'm going to mess this up, but one phase is animal studies. Yeah, phase 1 is animal studies. Phase 2 is you give it to humans, but that are healthy, so you make sure it's safe first. Phase 3, you give it to people with that condition, and that's how you get your safety and efficacy. Once you have that package, it goes to the FDA. They say, yes, we agree. The benefits of this outweigh the risk. Now I need to see your manufacturing facility. And they go in and do a check there. And actually, that's a large reason of why some things don't get approved, is they have manufacturing standards that they need to uphold first before they can get that approval.
Is that what they did with the COVID shot?
It is.
Is that really?
It is. They just did it at the same time. So normally, those steps happen sequentially, okay? And you need funding for manufacturing. Sometimes a drug gets approved and it doesn't launch for 2 years because they don't have the funding to get the manufacturing stood up, right? So it's not on the market even though it's approved.
That's crazy.
With COVID, they removed every barrier that takes time. So they were running those those phases at the same time. That mRNA platform, remember I said that has 30 years of evidence behind it. So they knew they had been testing the mRNA platform in humans for Zika, for pandemic flus, things like that. They were able to change the proteins in there and utilize that for COVID.
But does that not also require time for efficacy?
In terms of, it depends what outcome you're looking at, I guess.
Not dying.
Well, we had 85% efficacy with the hospital, keeping them out of the hospitalization and not dying from the vaccine.
But that was before the vaccine.
No. The vaccine itself had 85% efficacy.
I won't share too much because, I have to.
I think
I have to make sure
that conversation is going to open
Yeah.
I won't get too much into it.
But let's go back.
But let's put a pin on it because I have a few things to look into before I answer your question. See what I did there?
So
I'm going to research before I speak.
Yes.
That's it. Okay?
Yeah.
All right.
We could talk about that another day.
We will.
It's going to take a long time.
And then you go back to iron.
So iron. So there's nothing to worry about then, right?
What do you mean?
What do you mean?
If this is a manufacturer that does everything the right way, everything that you said, then we have nothing to worry about. So these
terms of consumption.
Yeah, because these are, and we're talking about a perfect world with a manufacturer that's doing everything the right way. These drugs or this iron pill doesn't come from La La Land. It comes from the earth. and they run the process in a way that they take the molecules. I'm horrible at science.
No, you're making sense.
So it comes out of the ground. Let's say we decide we're going to take it out of beets. We process it. We break the beets down to a molecular level. That takes time, and then we, how do you say it? We
extract.
We extract the iron component of it. I'm trying to say it as like so everyone can understand.
Yeah, you got
and
it.
then we run it. Once we get that component, we package it, which is the capsule that we consume, and then we run it through the test, which is the
Efficacy and safety.
Right. And then once that goes through that process, then it goes to the masses. Okay, I love that.
But then insurance has a say of is it covered or not.
Okay, here we go.
Right. And then manufacturers say, well, this is what I'm going to charge. And nobody has any say in that.
So we're ready to talk about the business side.
You want to talk about business side? All
so
right,
let's talk about the business side.
Oh, you know what? One other point I wanted to make that about we were talking about an active pharmaceutical ingredient coming from the ground. Some are made in the lab. It can be synthetic. And I think that's where you may have an issue.
That's where I have an issue.
Yeah.
But help me be okay with this. What are the level? So when it's one, how do they do that? Because I have a hard time understanding that, and I love that science has gotten so advanced that they're able to do that, and I'm okay with that. Again, like I don't want to be like a conspiracy theorist. I always have a hard time saying it. Conspiracy
theorist.
There
you
go. Wow. How can they do that? And how is it? What is it the same process to get to the consumers?
So yes, any drug that's FDA approved follows that process where there's certain trials that you have to do, certain applications, certain benchmarks that you have to show. The R&D part's a little out of my scope because that's not what I do. But my understanding is that like I have a very good friend who's in cancer research, and like she was studying, I think she was studying smallpox at one time, and they were utilizing the smallpox virus to make something synthetic in the lab to combat, let's say, monkeypox or something that has like a similar viral blueprint. So I don't know the specifics of how they do that, but it's often, I mean, when you think about like opioids, right? The opium comes from the ground. Lab people found fentanyl, which is a synthetic opioid that is, you know, a gajillion times stronger and kills people, right? So I think it all often will, like the active pharmaceutical ingredient might start from the ground, and then what happens in the lab, it evolves.
And I think that's where I have the issue because, and this is where science sometimes loses me, because sometimes it gets unethical. It gets to a point where we discover something, and just because we know it's a lot more stronger, we should still deliver it. Do you get what I'm trying to say?
Can you say that again?
Like, this is where I think science gets dark, I guess is the best way to say it. So let's say, yes, we're making this iron and blah, blah, like we're processing and then in the middle of us doing that process, we find that we can also extract, this is very, like, I'm sure this doesn't happen this way, but we find fentanyl in those molecules and us messing with the molecules. Yes, we know that it's a lot more effective than opioids. Why or how do we come to, and this is why I wanted to have you here, where between the doctor and the pharmacist do we say we should give this to this patient? You get what I'm saying? Ethically. You know what I'm saying? Because I think that's part of the issue. Like, how is it possible that the health community knowing, and the scientists knowing that this thing, fentanyl, is that, yes, it works, but it's so dangerous. It can be manipulated, or it can be consumed in an irresponsible way, and it can be addictive. So how do we get to that point where we get it out to the masses outside of This is just in the medical, because obviously corruption and the drug side of it and the black market side of it, like we can just get lost in all of that. But how does the pharmacist, for let's to not overcomplicate this, and a doctor come to a solution or a resolution that I should consume fentanyl, let's say, as an example?
Okay. So there's a few different ways. So the doctor diagnoses, pharmacists can't diagnose, right? So I would have to be told, hey, we're treating X, Y, and Z. Okay, great. Each